Hi there, and welcome to episode 112. Episode 112 of the ADHD Adults podcast. It never ends. I'm James Brown, the man for who, if he focuses on his body, vomits into his own eye sockets. And as usual, I'm joined by the man who focuses in a repetitive manner on bodies in general, but usually the ones piling up, Dr. Alex Connor. And of course, the woman who's focused on her biceps to the point that they repeatedly scare me, Mrs ADHD. Alex, hi.
Ooh, body form for you.
Fucking hell.
What?
It's the old advert sound for
I know what it is, but why?
Because we're talking about body
focus.
form.
I mean, yeah.
Do you two know how hard it is to say hello 112 fucking times?
Well, it's roughly about as hard as it is to make a joke about the shape of your head at the end of the podcast.
I know, he's just Googling fucking what's a round thing. What's round? What's round? I've only got an hour and a half.
Exactly. And Mrs ADHD, hi.
Hello.
How are you both? Mrs ADHD first, while she's drinking deliberately.
Knackered. How are you?
Well, nobody asks me. That's really thrown.
Sorry.
As a thing, it's an actual bit that nobody asks him.
I got really confused then.
How are you, James? How are you in yourself?
But that's an automatic thing. Somebody says, "How are you?" and you go, "Oh, I'm fine. How are you?"
Well,
Nobody cares. It's just they don't mean it.
But you haven't done for almost like 60 episodes that you've been recording with us, have you? So it threw me. Anyway, Alex, how are you?
I'm excellent, thank you, James. No, really, I am. I had a minor head. Should we call it a head snafu? But I'm fine again now, and I've had an awful lot of positivity from people. People I know, people I don't, people I hadn't responded properly to and needed to. So, and I appreciated every single message, of which there were lots. So something, lots of people listening, etc. One of them sent us a letter.
Ooh.
Yeah, that they did. It's from a Robert from Kidderminster, James, in a way. It says, I listened to your media episode and thought, your listeners might not know that James once worked with Angela Rippon on the BBC, and they did quite a lot of, and the next bit's redacted for legal reasons, but then it goes on to say, and now James is the only person who can't watch GB News in case he gets an erection. That's chilling. Thank you, Robert.
She's aced the Rippon.
Not the only one.
Working with her.
You did love working with
Well, I'm
her.
the same because of Eamon Holmes. I've had a real letter. Can I read it out?
No.
Yes.
It says, hi guys, I found your podcast last November when I was going on a holiday and I needed something binge-worthy to listen to. A couple of weeks later, I'd completely caught up and now I have to wait for new episodes, which makes me sad. Sad face. Unbelievable. I can never find my keys despite putting them in the same few spots every day, but I can remember to tune into this podcast every week without a doubt. Which means your podcast must be very good as I actually remember it. I just want to say thanks for all the work and effort you put in to educate people about ADHD, Alex, and it doesn't say that, I added my own name, and helping people with ADHD feel somewhat normal and understood. It's my birthday on the 10th. Today. And I'd love it if you guys could wish me happy birthday. Have an amazing day. Hallie, I haven't checked if we can give a name.
We
P.S. I want to give, thank you. Yes, I want to give Sam an extra big thank you for remembering to include this in the podcast and getting back to me on Discord so quick. She rocks, and you should let her take the lead more often. No.
Happy birthday, Callie. It's your actual birthday today when we're recording.
So,
lovely.
Obviously, happy birthday, Callie, but how did she know that you had included this in the podcast before her birthday, which is the day we're recording it?
Oh, she's psychic.
Makes sense. Makes sense, like pigeons.
Perfect.
Yeah, or Mystic Meg.
Internationally, James, really good question. We are, checks notes, can you hear it?
No.
No, I'm scrunching up paper as a joke to pretend I've got notes. Never is. Stupid posh mind.
I bet they're on microphone selected because you sound like a tinny robot.
The two are unrelated, I think. It's just,
It's just his voice.
Yeah. By one country to 158 countries. What are the chances? They're zero. This week's country is almost certainly not Malaysia, where one of the languages spoken is Malay. So happy salam dan selamat datang. And I'm so sorry. 2, one orangutan in Borneo whose forest keepers placate him with dull psychoeducation because it sounds exactly like other orangutans sleeping. And they're endangered.
Somebody asked, what about the week that we missed? Why didn't we go up a country then?
I know, just no one was listening.
Well, that proves that proves actually that we aren't gerrymandering these figures, and we literally do.
Yeah,
it's
one
country.
Gerrymander.
That's not what that means.
Per week.
Like a salamander.
Amazing. Anyway, as usual, this Canadian porch swing, Google it, of a podcast is a tragedy in 3 parts. And we choose a theme. Sam's going to go and Google it now. We choose.
I did Google it, James. And now I've had to put bleach in my eyes.
Oh,
because I wrote GIF and put safe search off.
Amazing. We choose a theme. Last week was about ADHD in the media, and this week we're getting back to slightly more. What? Have you just Googled it?
Yeah.
Okay. And this week we're getting back to slightly more normal territory by talking about body-focused, repetitive behaviours and ADHD. Thanks to Deborah for suggesting this topic. On the subject of Deborah's, Mrs ADHD and I bumped into one, didn't we?
Hi, Deb.
In Sainsbury's,
in
a mile from our house, and Sam just looked dead confused, didn't you? For about
I was terrified because I just thought, oh my God, should I know this person? Have I met them before?
Yeah.
You know, when your mind's just going, who is it? Who is it?
I have a wife for that. Who's this person? You lived with them for 3 years.
That must be so handy. We haven't got anybody for that.
Yeah, I've got a wife, but she's not very good at that.
That's what I'm saying.
Yeah.
So she was masking for the first 11 years, wasn't she?
So hi to both Deborahs. As usual, the 3 parts of the podcast include the usual start by the James Milner of evidence, Alex the Psycho,
Milner,
Education Monkey.
Hello.
Personal reflections on the theme and top tips, typics, loganing, spunk trumpeting, coming in your face, whatever you call it nowadays. So, Alex, for once, give us something. I can't believe I wrote this. I can't. I can barely say it. Jesus. Give us something nail-bitingly exciting. Oh,
I'm actually worried about you, James, doing jokes. Like that's an actual on-topic, boring shit joke that works.
Like one of yours? Oh, but yours.
Very much in my wheelhouse, isn't it? Exactly. Right. Body-focused repetitive behaviour disorders, BFRBs. For those of us who like abbreviations. It says here, I don't think it's an acronym, but you'll probably fucking tell me in brackets, which is James wrote that bit. You might know. Well done, James. Unless you're choosing to pronounce it BFRBs, and then it would be an acronym. It needs to be a word. Very good. BFRBs. So BFRBs, body-focused repetitive behaviours, are intense urges to bite, pick, and pull. The areas of the body, and that can cause damage. While BFRBs may look like obsessive compulsive disorder, OCD, on the surface, they're not the same thing. They are different from self-harming rituals for reasons. It's not always easy to spot them, but for reasons.
If you're watching on YouTube, just as you were saying that, Sam literally started a body-focused repetitive behaviour of biting at a finger all the way through when you were explaining what it was.
I mean, to be fair, it often comes with stress and boredom, and it's this bit, isn't it? So it's not really surprising.
I do this a lot, sorry.
And presumably, Sam, you don't think that something bad's going to happen to a relative if you don't do it, like with an OCD, which, I mean, that's too simplistic, but broadly speaking, it's just one of them that we don't even know we're doing it, right? And this is why it's slightly different. Are you ready for a boring list?
Yeah.
No.
Welcome back, boring lists. So it could be pulling your own hair, trichotillomania. It could be picking your skin, Sam. Dermatillomania or excoriation disorder. I like these words.
Ooh.
So skin biting, nail biting.
James wrote an actual word that's beyond.
Well, you say wrote, Sam. Copy and paste or chat GPT. It's always one of those two things. If it's spelled right. Which was it, James?
Copy and paste.
Someone said to me before, just really in a lovely way. It's FYI, when you tease James for being thick, it's really great. But when you tease him for not being able to read, that isn't linked to intelligence because they might not be able to read. And And it's such a good point. And we tease James, even though he probably does have dyslexia, and we will continue to do so.
Most of the scripts.
Really does.
They're really well written.
We'll talk,
they are. And
we'll talk
So-
about
and
that
he's-
next year on Thursday, won't we?
and he's genuinely a highly published scientist. I pretend isn't. I fucking love it. Oh, and he writes
I
for
love
newspapers.
that people actually believe that, though, and think that
They think that he's thick. It's one of my favourite things in the whole world, Sam. We've told it before, but you know when James was giving his little talks and someone said they wished I was there, so there'd be some psychoeducation.
Yeah.
Fucking Professor James. Love that. Love it when that happens.
Anyway, carry on. Sorry.
Anywho, we tease James, not anyone else. That's the point. So nail biting, nail picking, cheek biting, and eating hair. So trichophagia, which means hair eating. Rhinotelexomania. Rhino means nose, so that's nose picking.
Just give her a second. She'll know. Just give her a second.
Oh,
right.
sorry. James does all of those. You don't, though. Why have you got me to say that?
Because it's called a joke. Then that
Yeah, right.
sometimes.
Okay.
Yeah.
Oh, James
It's
does all of
hyperbole,
those.
Sam. It's like, oh yeah, James does. But if you read it like a robot going, James does all of those.
Yeah.
And obviously it comes across as a
I'm
scripted. part
sorry.
of the
I
show.
normally just say whatever comes into my head, but
Oh,
No.
that
What?
didn't happen.
Eh?
Anyway, James does all of those.
He does do all of those, correct? Excellent question, Sam. Right. I'm not doing this next bit. What I was going to say in response to you saying that was, no, Sam, James bites other people's skin because he's a Dracula. I'm not doing that joke.
You've just done it.
Right.
Okay.
So everyone knows what I'm going to say next, obviously, because it's now a bit of the show. So get
Do
on
the
with that.
accent, Alex.
Calm down, Bab, will you? Oh, James, can I ask you a question, James? Honestly,
Yeah.
take this picture. Do you think we'd be talking about this topic if there wasn't some link to ADHD? Indeed, James. Right, so this might be a shock statement for you. There isn't a great deal of research on the subject of ADHD. These factors, BFRBs. There is some evidence, though, that these BFRBs may be particularly prevalent among individuals with psychiatric conditions. In general, mixed results. I'm afraid in the studies there are. There is also evidence that some of the behaviours are increased in ADHD. Why? So one study reported that a diagnosis of ADHD was associated with greater rates of different BFRBs, different pickings, and so on. Reported by parents, that was, and the types of them and the severity of them. That was both in children and adolescents. About 40% of the young I don't know why we've written young'uns in the but it's made me laugh just reading it. Of the young'uns today, always picking at their skin. Reported at least one BFRB. Right, so we have got little bits of research, and it's just the second boring list klaxon of the day. Small study, I know. A small study of people with BFRBs found that 15% of the population studies met the clinical threshold for ADHD, which is a lot higher than average, isn't it? Which is around the 2.5% mark, probably. ADHD was one of the most common coexisting conditions associated with hair pulling, trichotillomania, for nail biting, which they call onychophagia. Sometimes I've only seen these words written down, so I always used to say hyperbole for hyperbole, James, for example, because I didn't have any friends, I just read instead. Patients with Tourette's syndrome, and this might not be surprising, and ADHD had a significantly higher prevalence of nail biting than just Tourette's when they had just had Tourette's. So in a population of nail biters, not neck biters, James, because you're Dracula, 3/4 of them are comorbid. That's nail biters. Wow. ADHD.
Wow.
Skin picking, frequently seen in children with ADHD, and that could maybe be treated with methylphenidate, the Ritalin ones. Nose picking or rhinotelexomania has been reported in a number of case studies of ADHD, perhaps not surprising because it's impulsive and physical. So it seems that ADHD probably increases the likelihood of also having these BFRBs. But as ADHD very, very rarely is on its own, unlike James in a hotel room, who is, as other, unless it's prey, as other psychiatric conditions that ADHD often coexist with, also increase the chance of someone having these BFRBs, OCD and autism and all these different things. It's so difficult, nigh impossible to determine if you're doing these behaviors because of ADHD or because you've got other stuff too. It's related to comorbidity in general. We don't know.
So what can be done about this? Because you said about methylphenidate, but my meds haven't stopped me doing all the stuff.
Yeah, indeed.
I didn't.
No, I know. I can react. Don't worry. I've learned, Sam. I've learned to react to you just saying something else. It's a really good question. My main advice, stop James from picking his nose, as you asked, will be to hold your thumb between your fingers and tell James you got his nose. He'll absolutely 100% believe you. That is probably a quintessential IED, joke IED.
It is. It's amazing.
James.
It's incredible. It's incredible because she doesn't plan it. It's not like she actually thinks, oh, there's a joke coming up. I know what I can do to derail it.
No, not at all.
No, because I don't read the next bit, so I don't know what you're going to say next.
Or the bit before.
I know, or any of it. I just think, I know what I want to say here, so I'll just say what's in my head. Sorry.
It's spontaneous IEDing that she does, isn't it?
The only plus side here is that the thought of you pretending you got James's nose with your thumb made me and him getting really upset delighted me. Give me the fucking nose back, Sam. I mean, give me the bloody nose back. Hi. Excellent question, Sam. Short answer on meds. It'll vary from person to person. Like with tics, there is anecdotal evidence that new or worsened habits of these BFRBs may become more apparent after starting stimulant medication. But it depends on the individual, on the drugs, on coexisting conditions, ASD, OCD, etc. So the issue, just like when we hear about Lisdex and tics, people say, oh, it's just like a known thing, isn't it? That Lisdex increases your tics. And then you look at the data, not true. In the data, the clinical data says no. But here's the thing. There may be subsets in that data that they haven't analysed, and we're missing those. So you might look at the stats and say, on average, it's the same, but actually there might be a big group of people. Because we hear it all the time from people that used to have tics that said they've come back with Lisdex. We hear it all the time. It could be, of course, that they sought treatment because they were in a particularly stressful period of their lives, and stress also includes tics. Who blooming knows, Jones? Ah, man. What we will say is that if you can access and you're lucky enough, professional help from a mental health care provider who has been specifically trained to treat these BFRBs is probably a really great approach to try. There is some evidence that talking therapy, CBT, and acceptance and commitment therapy, ACT, and habit reversal training, which obviously does what it says, can help people with these. Certain meds, such as SSRIs, the depression ones like Prozac, have shown, and anti-anxiety ones, have shown some effectiveness in treating them. If you can access support groups or get peer support, this can be helpful as well. If you share your experience with other people, so even just a sense of validation and reducing those feelings of isolation, shame, and so on. Practical tips that have worked for other people for managing the behaviors, all that can really help. Finally, if you can do it, so presumably you haven't really got ADHD. No, you have because I can't. It was a joke. That was a joke at me, really. If you can do it, mindfulness and relaxation techniques always makes it. Just sit quietly for an hour with your ADHD. You'll be fine.
Just clear your head.
Just try to planner, Sam.
Yeah.
So deep breathing exercises. My quick tip for that, I know we're doing tips later, is you can do that while you're doing something else. You don't have to sit in a room going om. So deep breathing exercises, relaxation techniques may help individuals to become more aware of those urges and those impulses, managing those stresses and anxieties, and reduce the frequency of BFRBs. BRB, James.
Oh, that was almost as painful as the pun at the start. I was just quickly before we go to the break, Alex and I were chatting to a friend about breathing exercises, weren't we? To William.
Yeah.
And I admitted that I had tried it once. I really didn't want to, but the only reason was that my good friend Frankie, who was the person that had punched me so hard in the stomach, I shat myself earlier that day, said, "We're going to do some breathing exercise." And I went, "Okay."
You know what would be more relaxing? Not being punched so hard you shit yourself. I can just imagine you go lying on the ground going, ironically, I can't breathe.
Yeah, with shit in my pants. Okay, we'll take a break and we'll be back in part 2.
Bye.
Alex, hi.
Aight. What's up? Hello.
Welcome back to episode 112
12.
of the ADHD Adults podcast, where we're talking about ADHD and body-focused repetitive behaviours. In this part, we've got personal reflections on the theme. James.
Almost flawless.
Really
That was
wasn't.
amazing. Logan.
Yeah, it was. I mean, I'm sure if Gabby Logan is listening surreptitiously to pick up
Hi,
tips on
Gabby.
how to end her career
Gabs.
and never
Gabs,
work
though.
again in podcasting, then she'll be definitely taking most of them from Sam.
Yeah.
Personal reflections. I have done a lot of that shit all of my life, and always just thought it's I'm uncouth, I'm ill-mannered, I'm
You are.
I'm proper. Well, coincidentally, I am uncouth and ill-mannered and
Yeah.
proper
The
common.
two are
etc.
unrelated, though, aren't they?
Yeah, completely unrelated. Exactly. I I will wait until. Well, not wait. I'll notice that I've got a nail that's got a millimeter of kind of nail that hasn't been bitten, and the thrill I've got. Oh, brilliant! There's a good one, and then just get perfect in a perfect strip of nail, and the satisfaction I get from that. The skin around my nails is so bitten that if I have a bath, which I do every so often, and the skin on my fingers soaks up, you can see the like troughs where I've bitten away skin around my fingers. I bite my nails and fingers until they bleed, and then carry on biting even when they're sore, because I then want to trim back the skin that I've bitten around that's made me bleed. It's just, and it's not like you say, because I think something bad will happen when I do it. I kind of have to do it. It's really weird. But for me, the big one is nose picking. Not because I've got a big nose, but coincidentally, I have got quite a big nose.
Yeah.
Yeah. Thank you for that, guys. But it's the way for all of my life. And Sam, I'm absolutely not getting at you when I say this, but particularly in our marriage, because it's not your fault. But I pick my nose a lot. But Sam says in exactly the same tone every time, "Do you want a tissue?" And when she says that, I hate myself. The shame. And I always just say, no, it's just really dry. It's nothing. It's just really dry. Nothing up there. But I feel like a 6-year-old boy ding, and just feel so embarrassed and so ashamed. Like I'm a dirty, ill-mannered, uncouth, common pleb that never got.
Who's also picking his nose.
Who's also picking his nose at the same time. Yeah, I mean, I never eat it. That's one thing. That's a positive, I suppose, isn't it? That's a plus. I do flick it occasionally, but I don't. I pick it and flick it. I don't pick it and eat it. So for me, the other thing I suppose is scabs. If I do, for example, when I had a fall, Alex, if you remember,
your little fall.
My little fall a while back. I obviously, as soon as that scab is formed, I'm chipping away at it, trying to get it off, and again to the point that it bleeds. Yeah. And then I let it reform, and then pick it again till the point that it bleeds. It scabs like heaven for my BFRBs, because it's like something new I can pick at.
I know, and they just keep coming back.
Exactly. They're made for it. But there is something we'll talk about in the top tips on Thursday, which actually Sam and I found, which is probably better than BFRBs.
It's amazing.
Exactly. So, Sam, what about you?
Yeah, I've got loads of these. I didn't know that this was a thing, so I just thought they were tics or stims. I didn't know there was a whole different thing. If I feel, because everything has to be smooth, that's why I ended up sanded down the walls for 16 hours. So if I feel any imperfection, you're right there, James. If I feel any imperfection on my skin at all,
everything has to be smooth.
Yeah.
And we didn't get a ding for. I was too busy spitting tea into my cup. We didn't get a ding for that.
Nope.
Okay.
I was
So
so busy thinking, is it a stim? Oh God, we probably need to explain the difference at some point. That's why I was not on ding patrol.
Ding patrol.
Ding patrol. Yeah, so if I feel any bump or lump or scab or anything, I've got to pick at it, even if it feels smooth, even if that makes it really, really bleed. I've just got to get, and then obviously it keeps scabbing up and you keep picking at it again. The worst probably thing is my mouth, because I'm always biting my tongue and my cheeks. But what I really love is I've got like a permanent line of like raised and harder skin inside my mouth, which I can always fucking bite at. And I really like that.
Lovely.
And my lips. I have to keep my lip. This is why I have to have lip balm on all the time, because if I get any dry bits, then I've got to bite at them, and then all my lips are bleeding and swollen and bloody. I do pick my nose as well, even though I tell you off for it, because I love it when it's really dry and you can just get all the dry flakes from within the nose.
The incredulity on James's face.
That's why I always have tissues with me.
And also doesn't stop me from doing another ding. I love it when it's really dry. I mean, it's not even tenuous. That's definitely a ding.
Yeah, it's the full ding.
It's an awful one, isn't it?
Yeah, really.
I also get it with my eyes. I get convinced that there are things in my eyes, but either by looking at them or I feel like that there usually aren't, and I'll pick at them until they turn. You know, when your eyes turn to jelly, and then they kind of gloopy.
No, what the hell?
Yeah, if you pick at your eyes so much, they
don't pick at your eyes.
I can't fucking stop it. That's the point. Oh right. How do I fucking stop it then?
Don't pick it. Like special glasses, NHS glasses.
I can't stop.
Goggles, swimming goggles.
Things.
Don't pick at your eyes.
Anyway, I've got loads of these. I could go on. Go on, Alex. Tell us yours.
Your eyes, biologically speaking, are what we call a soft entry point. We have a few of those, and it's one of the key. I know it's one of the key elements of serious bacterial infection. Don't pick your eyes. I know you're absolutely right. No, you can't, and nor can I. It's the same thing, and dead quick, because I know it isn't psychoeducation type, but nail biting can be a stim if it's done during stress and anxiety, and it kind of comforts you as a repetitive activity. But sometimes it's for all of us, but if it's like, oh, the nail looks perfect for biting, get dopamine, lovely reward from that. That's more of a BFRB. It's more of an ADHD thing. And we do both for the different reasons. And we don't realize maybe that they're two different things, but that they can be. No, absolutely, Sam, all of those, except the eye thing. The shame. It's the shame for me and the guilt of being a pathetic, impulsive, dirty sort of idiot for picking your nose and nail biting and touching my face, all the touching. I can't help it. During the pandemic, you just felt like, the worst. All of it really is very horrible when you're impulsive and you get dopamine from it. And I have tried everything to stop this my whole life, even as a little kid. I use so much of. Do you remember that noxious stuff you paint onto your nails and it tastes horrible?
Yeah.
I got used to the taste of it. I didn't learn a single damn thing. I mean, James, do you remember when I had that heart condition at Christmas that, it turned out to be I was just frightened of having my blood pressure checked at the doctor? Well, it all started because I picked my nose so much. I lost half a pint of blood and had to be cauterized at the clinic.
Did you measure how much?
Yeah, well, I mean, it was pouring, Sam, for about 2 hours before I had to get to the doctors. It was, imagine how much a tampon can hold till it's full. I'd used 13 tampons when I went to the...
What
not in your nose.
No. Yeah, that's unrelated again. I like that joke. I've done it 3 times today. I apologise. I'm doing it again. So, actually, it was relatively recently that I've started to forgive myself. That was an absolute revelation that I don't want to do these things. I have somehow persuaded myself that no one notices when I'm picking my nose by hiding my face. They definitely see you. They can see you doing it. Why do I kind of do
this. I kind of just stick my nose in like
that. They can see you. They can see you because you get distracted and it goes right up there. Absolutely.
That was a big thing.
What I do now, James, is I just turn round when I'm doing a Canadian porch swing and have it done for me.
Oh, do you know,
That's in
something
the top
else that-
tips, but that's an extra one for you.
Actually, it's
Well,
probably not one. Sorry, carry on.
Forgiving yourself. This is the key. It's not easy. None of this is, but emotional acceptance that you have a dopamine need much more than, not literally, other neurotransmitters are available more than anyone else. And I have too. And so I don't associate it with the positivity, like an impulse or a compulsion or anything like that. Just can't easily restrict my physical thoughts because I have a neurological disorder that means that's what I can't do. So to then go, what a fucking dirty idiot you are, Alex, is really ableist and really unhelpful. So in actual fact, there are things you can do to reduce it. First thing you need to do is accept it a bit. That's it.
Bob,
Time for
No time for the game, I'm afraid.
Yeah, no, there is time for a game, Alex. You can talk for as long as you want, mate. You can wax lyrically, just trying to waste time, burn the clock down, but there's still going to be time for a game. So it's about my glasses, which has come up more than once, actually, on the game. Yes, we'll take it. We'll take it. Ding.
Ding.
So I spent about half an hour searching for my glasses. I think it was the day before yesterday. Like really angrily, quite frustratedly searching for my glasses. But what was the really silly reason behind searching for them? Was it A, I was looking for them even though I had another identical pair right in front of me, but because I'd lost the other pair, I had to find that other pair. So was I, even though I had other glasses which would work, no, I had to find that pair. That's A. Was it 2? I actually had them just tucked into my t-shirt there all along, and I was looking around, and then it was only when I looked in the mirror that I went, oh, for fuck's sake. So I had them with me all along.
Okay.
Or C, right at the start of searching for them, did I pick up a big pile of crap of papers and stuff and glasses, move them out of the way, and that's where they were when I found them half an hour later.
Right. I think it's not the last one because you never move anything because Sam's all tidying. I think it wasn't tucked into your t-shirt because you only wear a big black cape because you're a Dracula. Therefore, you literally were looking at some, and I can just see it as well. I can see you like going. I focused on this one thing I have to do, which is fine. I mean, I could just use those. So that's what I'll do. And you know, I know from your face that I'm absolutely right.
Yeah. I bought you a pair. Just found them.
No, right, literally right in front of you.
Literally on your desk.
That's amazing.
Yeah, I bought 2 pairs at the same time, and I was looking for them. After like 20 minutes, I noticed the glasses case with the other pair in. I thought, yeah, but I want to find the other ones. And for half an hour, I was looking around, and in the end, I just gave up and used my laptop without glasses, and was really straining. And I've just fuck my life found them.
Amazing. I just bought reading glasses that are sunglasses for outside.
James Dean reading a book outside. Right, we'll take a break.
Like he would have done.
Alex is 12-10 off the year, I think now. Look at him. Look at his round face. Right, we'll be back in part 3 for some trumpeting of the spunk. See you in a bit.
Spunk trumpet.
Welcome back to episode 112 of the ADHD Adults podcast. We're talking about everything BFRBs, BFRBs. We're talking about nail biting, nose picking, skin picking, and Jay and Sam making jelly eyes. Don't do that. As always, part 3 is top tips, gabiloning, spunk trumpeting, and so on. Have we got any top tips, seeing as we all do these things and we do have to reduce them, especially in company? I will actually, what Sam's doing right now, if you're not watching on YouTube, which is squeezing a squishy stress reliever, is literally a medically proven top tip for BFRBs. So I'll start with you, Sam. What's your top tip?
Do you know, this wasn't even something I was going to say.
Unbelievable.
But actually, yeah, keeping your hands busy, ding. And they're the kind of only things that work for me, keeping my mind distracted and my hands busy. So like if I'm watching TV, I'll often always kind of be on my phone just to keep my hands busy, but sometimes I'll be making ear cuffs or just doing something to kind of keep my mind off it and my hands busy. And sometimes that means doing more than one. In fact, always means doing more than one thing at a time. And moisturizing. I keep myself moisturized all the time, because then it stops the likelihood of me getting any kind of dry bits on me, which then I'll have to kind of pick out.
Yeah, I was thinking, maybe we'll think about that one.
And core still for my mouth helps to.
What's that, Sam?
So it's like an antibacterial
chlorhexidine based mouthwash
that help, because I've always got cuts and shit inside my mouth, and it just helps to heal it a bit quicker.
That's a very niche thing.
I know it's niche.
The Canadian porch string of the being honest.
Don't kink shame me.
When I have to, no, that's not probably the same. Every time I blow my nose, because I can't.
Oh yeah.
That'll be a sensory thing though. And I can't stand the inside of my nose being wet, so I have to actually wipe my nose with tissue
for 5 minutes
to make sure that it's completely dry. Which then, when you've got a cold, it really. But that's probably not one of those. It's just a sensory thing that I don't like my nose being wet. Yeah. But I was thinking, when you said SSRIs, I think I did this less on SSRIs.
Yeah, I mean, that is literally there is evidence that that's what happens for some people. Yeah,
I might have ticked less as well. But
so
anyway.
they're anxiolytics, Sam, SSRIs for many people, and a lot of these BFRBs come from stress and anxiety, where they could arguably be called stims. So you probably didn't, the sort of habit, it wouldn't probably have helped with that bit. So you'll do it occasionally, but it would help with the ones where it's stress induced more. That's what the evidence maybe suggests. I'm not strong here because the evidence isn't strong. But
okay. What about you, Alex? You got any tips?
Yeah, it's weird that because James is next in the script and now I'm confused.
No, he was first.
I know, but because why did you do? No,
you fucked it up then, Al.
I'm confused.
Anyway,
Anyway,
I'll go. Shall I?
Yeah.
Shall I go?
If you could, that's what I asked.
These are my favourite bits. People think we hate each other when actually we just both hate James.
Fair.
Let me say this one thing. I said it a million times before. Don't set yourself up for failure.
Okay.
If your aim is to tidy the house by the end of the day, however much work you do, you will feel like a failure, because that is one of those phases without an end. Instead, if you say, I will empty half the dishwasher, you start tidying the house and you empty the whole dishwasher, you've smashed a target. Cleaned, the sixth bedroom, have you? That's still, that's still from when the butler was in there.
Yeah, got rid of 3 of the bodies as opposed to all of them.
So, this is true of anything you want to change with ADHD. There is 0 point somebody with ADHD, probably anyone actually, saying, I just won't do this thing today or forever. Today is a really, really long time in ADHD brainland. And therefore, if you say I won't do it at all today, if you do it once during that day, only once, and normally you do it 50 times, that would be seen as a failure by your emotions and your brain. Does that make sense? You're setting yourself up for failure with this. These proclamations never work really for us, and they tend to end in failure because even massive success looks like failure. So here's what you could do. For example, say, I will stop myself from doing this only 3 times today and I'll mark them off. And if you manage that, it's a massive success. Even if you've done it 47 other times, it's 3 less. So if you want to do it for nose picking, for example, one just practical tip is clear it all out in the shower, or when you're washing your face, and specifically you're washing your face with really cold water in the winter because you can't wait 3 seconds for it to warm up. So fuck you, I'm having freezing cold water on my face.
We all know that.
Clear out your nose then. And you can, in the morning, get a comfy elastoplaster, and put that on your main nose picking finger, just for an hour or something. So it'll just trigger you. When you poke it, you'll be like, oh, that's a weird new sensation. Oh, it's because I'm not picking my nose 3 times today, and tick that one off. And then you'll it won't last all day because you'll get used to it. But little practical things like that can be incredibly, incredibly helpful.
Oh, do you want to ask James what if he's
No.
got any tips?
No, I've got a last thing, which is
Well,
you can
what
get
the
a
fuck was that pause? I mean, that was a fucking eon.
In your head, Samantha.
It was.
As was that one.
No, I honestly did it to see what would happen. And that
Oh,
happened. So you can get a fidget spinner as well, which is like Sam's squidgy ball, anything really where you can click your fingers, use your hands, ding, and play with your ring. James plays with his ring a lot to the point where, let's just say he's in a medical textbook. Fidget spinner, incidentally, is what James calls Angela Rippon. Fallback joke.
Oh, yeah,
James?
I mean, that did happen. Do you remember, like, back in the day, Al, in like the OG episodes, when all my tips were shit? I mean, really fucking shit, and yours were
It was
good.
111, wasn't it? Really?
This is a callback. A tip, I suppose. No, I've got nothing that
a
hasn't
call
been
back
said.
to when your tips were shit and they're still
Yes.
shit now. Yeah,
Yes, exactly. It's a callback. It's a callback series of tips. So I haven't really got much, to be honest. What I would say is possibly that, and this has happened since we've started. Obviously, we've known the BFRBs and ADHD associated for ages. It's not a recent thing. We haven't just written the script in the last couple of weeks after somebody asked us a question for the 100th episode. We've known about this for ages.
Be stupid. Embarrassing.
Yeah, it is really. And it's actually only since I've realised, with the nose picking in particular, that one in particular, and particularly when Sam does say in exactly the same tone, do you want a tissue? And I just, it's like the, and then the making excuses. No, it's just dry. There's nothing coming out, etc. And hating myself is, I think, maybe when next time she says that, kick her in the spine as hard as I can.
No,
Okay.
that's not a good top tip.
It's not, is it? If
No.
maybe just internally or even externally say, well, I'm not really choosing to do this as such. There is some kind of driving force behind this. Whether I say that externally or internally, then hopefully maybe I won't feel like such a
I
pathetic.
won't give a shit because I'm only doing it to make you feel like shit.
Yeah, it's on purpose.
I mean, I don't give a shit if you pick your nose. I just want you to feel like absolute shite.
Yeah. You're shite. I've been reading Fern Brady's amazing neurodivergent autobiography.
I don't know who that is.
So I can't help but say pure shite. James, Sam, have you stopped one? Is there one, like, I don't bite my nails anymore. Have you two stopped one?
No.
No, God, no. My fucking scalp is a really bad one. I make that bleed. I pick it so much, and any scabs and things on me. Yeah, sorry. I can't stop them. But you have got an actual tip, James.
Yeah.
Well, but I haven't really. I mean, Alex, I can't. Oh my God, this is RSD. So I was going to say pragmatic tips like putting the bad tasting thing on your nail for nail biting, but because Alex mentioned it earlier, instantly I'm like, oh no, it'll sound like
we've got the thing that we fucking love.
The thing, right? Yeah, but it's not a practical tip. What if you live in a block of flats? What I would say is, Sam, if you recall, I think it was in the last episode, Sam said,
I was a gardener. Yeah, I was.
Sam had spent a day and a half, and by that I don't mean some periods of time during 1.5 days. A day and a half digging dandelions out of the garden with a little fork, and we had visitors round.
Oh yeah, we did. Yeah.
Yeah, her brother
who's going through a bad time.
Yeah, first time Dave's been round in ages, invited him round, and then just sat in the garden digging up dandelions. Jack was here as well, and he sat out there with her for a while actually. Well, Dave and I were fiddling with the guitar, and but then Jack had said to Sam, "Why don't you get one of those weed pulling tools?"
Oh yeah.
And Sam ordered one, and now I thought she was never going to use this because she didn't check when it got delivered, and it didn't come the next day. And normally with Sam,
and I'd gone off gardening by then.
She'd gone off gardening. And she was using this. So it's one of those things. It's like a long prong, and you put it on the ground, push your foot down, and then you pull it up, and it pulls the weed out. And Sam had been using it. And I was like, whatever. And then I thought I'll have a go, and oh my God, the satisfaction you get if you pull up a whole perfect weed. I've got to do another one, and then I've got to do another one. And during that period, and even for a while afterwards, there was obviously no biting of nails or picking up, just because I had something else that was satisfying me while I did it that was
Thing.
keeping me busy and not making me.
And you just can't stop thinking about it. All I was thinking about, even with the fork, all I was thinking about was picking up dandelions.
Yeah,
and it's kind of the same thing for me, the lawn and my skin. I just wanted it to be smooth and dandelion free, like I want my skin to be full of holes and bleeding.
This is relatable to someone living in a block of flats, or anybody, because what you're describing there is replacing the reward. So there's anticipatory reward, but but on top of that, it's double bubble, isn't it? Because you've got the immediate reward, but then you've got the second reason to do it, second dopamine, which is a nice garden, and that's true of my nails. The way I did that. Say again, go on, Sam.
And as well, it's almost gamifying it, because sometimes you don't pull it out all the way and it doesn't feel satisfactory.
Yeah.
If you get a really fucking big dandelion and it comes out whole, you're like, oh, fucking yes. It's
uncertainty.
Oh, yes, that uncertainty. The
uncertainty of anticipatory reward. This is what dopamine is. How the gambling companies work and all these like little flashes.
Yeah, and you could just go out walking with a dandelion picker and find any lawn and do it.
That would be weird socially.
I'm not sure.
Right. Oh, we're all against weird, are we?
I'm not sure. Weird. I'm not sure that the technically legal destruction of somebody else's property.
Not somebody like a park.
Well, you said any garden, so you're going to walk into someone's garden with a dandelion plant. Just doing your garden, mate. Don't worry.
I'd be so happy. No, I didn't mean it was weird for others, Sam. I meant I would be too uncomfortable to do it. What I meant, because I don't know social rules. Is this fine? Is it all right for me to do this? I really don't know any rules. Is this okay? What? Have you been divorced? I started a conversation the other day with, how was your divorce? Total stranger, never met them before. But
how did you know they got divorced then?
They mentioned it. Luckily, they had ADHD.
Total stranger then.
Sort of. Well, like I'd known them for about 30 seconds.
Yeah.
But it's happened before. It's ADHD people. I think we really struggle with small talk. It's similarly to autism, but it's different to autism because it's just that I'm not bothered. It's not like what the fuck are you supposed to do? It's like. Whatever I feel like, say anything. Yeah. So impulsive. I got distracted.
Oh, yeah, that is different to me.
So are we agreeing then that I actually had a really, really, really useful
really good, yeah. And actually relatable and generalizable, which is trying to replace it with something else that gives you reward. Yeah. Is a benefit to you or the people around you that means something.
Well, then I don't mind losing the game. And on that note, and because I'm bored of you, we'll finish there. So that was episode 112
round things
of the ADHD Adults podcast, where we covered ADHD and BFRBs, or body focused repetitive behaviours. If by a miracle you enjoyed any of this, particularly Sam ruining at least 2 jokes, I think it was, then why not support the charity on the link provided, because otherwise Alex will have to carry on doing something that is somewhere related to the roundness of his head, but I didn't have time to think of or write down before we recorded. Contact us if you want to get in touch with any questions or comments on the discards. I have to fucking say that myself now, don't I? Socials at the ADHD Adults or whatever. See you soon.
Bye.
Bye all.
Trigger warning, klaxon, 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 big klaxon. Trigger warning, klaxon, 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 klaxon. Trigger warning, klaxon, 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 klaxon.